Hope you're all healthy, safe, and well in these challenging times. I'm Ed Shin, CEO, co-founder of Quality Reviews, and I wanted to welcome you to our webinar, Insights from Grady Health, the Future of Service Recovery and Staff Experiences.
A glimpse of us today. Grady is the busiest level 1 trauma center in the state of Georgia and one of the busiest in the United States. We see 1/3 of all traumas in the state of Georgia and even beyond. We often get patients from Alabama or Tennessee. Grady has the only public burn center in the state of Georgia and the only one in the state that will see children. So Grady is comprised of our hospital, where we are licensed for 953 beds. We also are affiliated with the Children's Hospital right across the street from us that's run by CHOA. We have the largest EMS in the state, and we serve 17 counties. We are also responsible for Atlanta's 911 services. And we're a teaching facility for 2 medical schools, which is a little unusual. Both medical schools train here. That's Emory and Morehouse. And also interesting, we are the level 1 trauma facility that cares for the President of the United States and his cabinet when they're here in Atlanta. So anytime the President or anyone in his cabinet is going to be visiting the area, we are on standby from wheels down until they clear the Atlanta airspace on their way out. So over the years, from our inception, I think a lot has changed about Grady. So to move from a space where we were so segregated into what we have today, and even the public opinion, there's been a shift about that regarding Grady. So in 2007, Grady was really struggling financially and about to close. And it was at this point that the community of business leaders in Atlanta realized what they could lose and that Atlanta truly could not live without Grady. And some of you may or may not know this, but without a level 1 trauma center, a large city can have no major sporting events. There can be no Final Four. You really can't have a lot of major employers. So a level 1 trauma center and having that available is really important. So in 2007, the Greater Grady Task Force was developed, and this group was to seek, the purpose of their existence was to seek long-term funding solutions for the hospital. And at that time, we did away with a government-based board of trustees and moved to a private, not-for-profit board.